Welcome now to a session of our annual meeting that has been a staple on our agenda for the last 5 years. Our session called Under the Dome. In this session, you will hear from some of our allies from within the kidney community and our shared agendas on legislative and policy issues that are being discussed in the U.S. Congress, on Capitol Hill, as well as issues that arise within the White House. AAKP has a national strategy designed to impact all policies that impact your access to new medical treatments and that may determine how your medical professionals and care team are able to do their professional work. In the fight for patient care choice, AAKP never wavers. We never waver on our principles, and in order to achieve our goals, we ally ourselves with tested allies, professionals who are the best in the nation at crafting sound, patient-focused policies. Welcome to Under the Dome. Our first panelist, Ms. Peggy Tighe, is a principal with Powers Law Firm. She works in the area of government relations and legislation, and she serves as the general counsel for the American Society of Transplant Surgeons. Our second panelist, Mr. Rob Blaser, is Director of Public Policy for Renal Physicians Association. And our third and final panelist is Dr. Crystal Gadegbeku. She is a founding member of the Diversity and Inclusion Committee and member of the Public Policy Board for the American Society of Nephrology. Peggy, I'm going to turn it over to you, and then we will proceed from there.
Hi, AAKP. This is Peggy Tighe. I'm coming to you remotely and dying to talk to you. Can't wait to have a good presentation for you here today. I wish I could be there to see all your smiling faces. You really do invigorate me. And it's wonderful to work with AAKP with Paul and Richard. And I'm lucky to have them as friends and as colleagues, and thrilled to be here with you today. So let's get started. I am here to talk to you about key issues in Congress, current and emerging legislation. I am Peggy Tighe, as I've mentioned. I'm a principal at Powers Law Firm. My job is to decipher and interpret highly complex, sometimes really complex healthcare matters and try to translate those into action. I work with patient groups like AAKP and other provider organizations to try to influence Congress and relevant agencies. I've served for as the legislative counsel to ASTS for many years now, at least 6 or 7, and I have 30 years of government relations experience. What are you going to talk about today? We're going to talk about challenges in Congress. We're going to talk about opportunities, and I'm going to get real specific with you to talk about kidney-specific issues. We're going to start with immunosuppressant drug legislation, and then we'll move on to Living Donor Protection Act. Challenges. Boy, have we seen some challenges this year. I think the 116th Congress will go down in history as one of the saddest, most complicated, and challenging years ever to work in or with Congress. We all know the horrible statistics. Over 150,000 Americans have died from COVID. We also saw the loss of 2 incredibly great leaders in Congress, Representatives Elijah Cummings and John Lewis. And COVID has eclipsed nearly all legislative policy issues, at least for the last several months, while our country is trying very hard to address these very difficult issues. Congress is generally a stalemate just now over additional spending, and the policies that they're advancing are trying to thwart COVID's impact. We really have spent a fortune and then some addressing COVID, and we're not sure how or when we're going to recover. With that sobering news, I'm going to dive into some opportunities. The 116th Congress can also be considered one of the most hopeful and inspiring of times. I actually did say that, inspiring of times. What we've been through, I think, can just make us stronger. And I know you're all fighters, and I know you're all champions, and I want to hope to inspire you like you inspire me to continue to do that. Congress has proven 4 times this year that they can work together in a bipartisan fashion to address a global pandemic. That's a really big deal that they have done that several times this year. Healthcare is no more important now than it has ever been. It's always been incredibly important, and boy, is it more important now. We are, and we will do so many more things better because of the pandemic. I kind of call it my thank you COVID moment, as strange as that sounds, is I try to get myself in a place of happiness with this pandemic and say, what's going to be better going forward? And what I think is going to be better going forward is telehealth, provider licensure across state lines, more home health, collaborative efforts to get vaccines developed, facility safety, and preparedness, God forbid, for the next pandemic or for other things. There's also never been a better time to advance kidney health. And this White House has propelled us in the right direction. So what is the path forward for kidney issues? We've learned a whole lot about ourselves and about Congress and about policy in just the last couple of months. What we've learned from my perspective as a lawyer and a lobbyist who works to support kidney patients and the physicians who serve them through the American Society of Transplant Surgeons is that we have to be patient. We have to be understanding of what Congress is facing, but we also have to remain tenacious in helping and asking them repeatedly help kidney patients. But you may say, can Congress do anything other than COVID this year? It's all we're hearing about is COVID this year. I believe they can, and we can help them do that. Congress is deeply aware that there's an election in November, and they also need to deliver for the constituents back home. I've talked to many, many staffers, hundreds really, in many years, and in the last 4 or 5 months, dozens and dozens who have told me that their members of Congress want to go home and do something for their constituents. A good public servant will say that and will mean that. And this year, really, in the first couple months, there's only been 4 bills, those 4 COVID bills, while we're all adjusting and figuring out how to address these problems. So those members are now turning to legislative matters that aren't directly COVID relief related. Everything in healthcare is COVID related. Certainly kidney patients will tell you they're afraid because they're more susceptible. That doesn't mean that Congress is focused on healthcare issues or kidney issues when they're talking about COVID relief bills. So we have to be very careful. We again have to be patient and understanding and understand the words and understand the priorities for Congress. Most importantly, your voice matters, your vote matters, and I can't think of a single politician who doesn't want to help kidney patients. So the time really is now for you to get more active, speaking for yourselves and your families to fight for kidney patients. Let's dive into a big issue. Immunosuppressant drug coverage. You've heard about this one. You ever heard me speak or Paul or Richard speak before? You've certainly heard about this one. It's been a long time coming. This bill, as we call it in short form, the Immuno Bill, has been 17 years in the making. It was first introduced by Senator DeWine. Those of you from Ohio might know him now as Governor DeWine. AAKP, ASTS is the transplant surgeons who I represent, and AST is another group of providers in the transplant space. 3 of our groups have worked very closely together in recent years and for a very long time to try to make the immunosuppressant drug coverage bill a reality. So we have some good news. What the bill does, let's start back with that, is it would remove the limitation for Medicare patients for their immunosuppressant drugs. Right now, if you're a Medicare patient and you have a transplant, you get 3 years of your drugs covered, paid for, immunosuppressant drugs. But most of you know, you have to take those immunosuppressant drugs for the rest of your life. And Medicare only pays for 3 years of it. That doesn't make any sense, right? If the taxpayers are going to pay for you to have a new kidney, they're not going to pay to keep that kidney healthy. Doesn't make any sense. So this is what the bill does. It would remove that limitation of 3 years of coverage for those immuno drugs. So the good news, this bill passed the House Energy and Commerce Health Subcommittee, not once, but twice, first in March in the Health Subcommittee, and the second time just this past June in the full committee. So we have moved past a major committee that has jurisdiction over this piece of legislation in shining fashion. We are still waiting for action in the House Ways and Means Committee and also the Senate Finance Committee. The immunosuppressant drug bill has had a whole lot of timelines and hurdles over the years. In fact, it's been stalled repeatedly for two main reasons. The Centers for Medicare and Medicaid Services, otherwise known as CMS, couldn't figure out how and which patients use the benefits, how many would need it, and how they would operationalize the removal of the 3-year limit. I wish I was making that up. CMS couldn't get their arms around the who, the what, and the how of how to work this benefit, or the removal of the 3-year limitation, really. Guess what? They have. They have now changed their thinking, in no small part because the administration's leadership has said, let's go. Let's figure out how to do this. So that was a giant hurdle for a lot of years, is that CMS either didn't have the bandwidth or was very confused by the bill and didn't know how to move it. Now they know. Now they know how to do it, and they've given us the path to doing it, and that's great news. Also, second giant hurdle, the Congressional Budget Office, because CMS couldn't give them what they call technical advice on the bill, the Congressional Budget Office, which figures out how much a bill costs or how much a bill saves, could not, quote unquote, score the bill. So, couldn't do anything. So we couldn't go to members of Congress and say, this is how much pulling this limitation away will cost taxpayers. And guess what? Now we know, and the number's a good one. The administration's evidenced this strong commitment to pave the way for CMS action by two pretty extraordinary events. They commissioned the Assistant Secretary for Planning and Evaluation, otherwise known as ASPE, to perform a study. And in that study determined that there would be a savings for the immunosuppressant drug bill. Taxpayer money would be saved. That seems so obvious to all of us. If you're not wasting a kidney, you're holding on to it with those immunosuppressant drugs, then taxpayers should be saving money. It wasn't so easy to figure that out. They commissioned a second analysis just a couple weeks after that from the CMS Office of the Actuary. And that estimate, actually came in at a higher number of saving even more. So what did those two studies do? Those two studies, we think, had significant impact over the group that really matters, the Congressional Budget Office, because the Congressional Budget Office is the bottom line, literally, of how much a bill will save or cost. And the preliminary estimate at this point is $70 million over 10 years. That's wonderful. That's wonderful news. Think of it in the alternative. If this bill had cost taxpayers money, we would have a very difficult time having the next conversation I'm going to have with you, which is how do we move this bill in one of the toughest legislative years ever to advance legislation. We've removed the two most important hurdles. Now we got to do it in a COVID year, but I have faith in you. Our task, our chore, our job, our responsibility, in my mind, is to focus on the Senate Finance and the House Ways and Means Committee members. Of course, you can go to any member of Congress and beg and plead with them, please, please co-sponsor the bill. But if you want to get the bill to move in the couple of short months we have left, these are the members of Congress you really have to put the pressure on. The Senate Finance Committee members, Democrats and Republicans, and the House Ways and Means Committee members, Democrats and Republicans. And the ask is pretty simple and in bright yellow on my slides. Please co-sponsor the immuno bill and add it to any appropriate moving package of legislation this year. What do those words mean? Why so many words? What's important here is we're recognizing that there is COVID relief legislation and that it isn't our determination of what bill will move in what legislative package. We want to be deferential, but we want to be strong in saying we want this bill to move in an appropriate package of legislation this year. On to Living Donor Protection Act. Living Donor Protection Act is also a piece of legislation that's been around the block, probably longer than it should have been. And it is a very important piece of legislation where we have gotten this year alone more co-sponsors in the House and the Senate than we have for many years. And these are significant numbers. To have 67 Democrats and 13 Republicans in the House, and in the Senate to have 9 Democrats, 1 independent, and 9 Republicans signed on to that bill is very important. We have some wonderful champions, co-sponsors of the bill, Representative Nadler, Herrera Butler, and Senators Gillibrand and Cotton. They have all been very vocal and supportive of the legislation, and we are hopeful that with your support, with your action, we frankly just won't focus on the immunosuppressant drug bill, which is important and shows signs of movement, but we won't forget about the importance of the Living Donor Protection Act. Why? Because this administration is focused on transplant and living donation. And when an administration uses the bully pulpit to focus on issues, we should be running with them. There's also solid commitment in the organ donation transplantation space in Congress. Right now, more than ever, we need to capitalize on that. Once again, as with the immunosuppressant drug coverage issue, we are very closely working with AAKP, the transplant surgeons who I represent, with AAKP, with AST, and also with NKF. What happened about a year and a half now, is that the Department of Labor issued an opinion about the Living Donor Protection Act, and that opinion was that the Family Medical Leave Act does apply to organ donation. Why is that game changing? Because that was an important part of the bill. It was not clear up until the Department of Labor saying that the Family Medical Leave Act allows you to take time off to donate. It was not clear. So the Department of Labor came out and has this opinion letter. If you'll look it up online now, you can Google it right now and find out that it is clear that you can use Family Medical Leave Act to donate an organ. That's incredibly important. That should be kicking us into high gear in moving to a place where the bill would now codify that opinion. An opinion letter is important, but what's more important is codifying that into law, and that is one of the elements of the Living Donor Protection Act. So what does the Living Donor Protection Act do? For those of you who are new to this or don't remember, is the bill prohibits life, disability, and long-term care insurance companies from denying coverage or charging more for living organ donors. If you think about it, some of the healthiest people around are living organ donors. Why on earth would we allow life, disability, or long-term care insurance companies to deny those kind of people, those very, very healthy people? Somebody once said it to me, you have to be astronaut healthy to be a living donor. So in most cases. So it doesn't make any sense to deny life, disability, or long-term care insurance to those people who are giving the gift of life. So that would be prohibited for those companies to do that by this bill. The bill also clarifies the use of Family Medical Leave Act, as I mentioned, can be used in donation. And the bill would direct HHS to update all their materials to reflect these changes so that they are publicizing what it is the bill would do, or the law would do once it's passed into law. What are the hurdles here? The hurdles here is that there's been a legislative fear of, quote unquote, opening up the Family Medical Leave Act to other changes. There are folks on both sides of the aisle who have very strong feelings about the Family Medical Leave Act. Should it apply to way more things than it does apply to? Should it apply to fewer things than it applies to? So there's a fear if we put a bill on the floor of the House or the Senate, and in particular in the House, that there would be some mischief about what could happen to the Family Medical Leave Act in a time of not the best bipartisanship in Congress, but the Department of Labor opinion means donors can already use FMLA. So there wouldn't be an issue moving this bill on the floor about necessary changes to the FMLA if the Department of Labor's opinion is as clear as we think it is. What about the cost? This would be a mandate on employers to provide leave. However, the Department of Labor opinion says that employers are already required to do this. All we're doing is codifying that opinion. So therefore, there should be not any new costs. Unfortunately, the legislation covers so much territory, if you will, that there are 5 committees of relevant jurisdiction. What are you talking about, Peggy? Well, every committee has a set of laws over which they have control or jurisdiction. So when you write a bill and you advance it through Congress, it has to be sent to those committees of jurisdiction because they know the law. So for the case of Living Donor Protection Act, there are a number of different laws and committees that are invoked. So it makes it more difficult to move through a committee process when you have 5 committees to go through. With that said, before COVID struck, we had a number of conversations with our champions on the bill who have said they have gone to several of those committees who see no problem with the bill at all. So it may not be that we have to go through 5 committees of jurisdiction. It's probably that we have to go through 2 on the House side, and it'd be much easier than we had originally faced with this legislation. There is no question that what this bill needs to move is more co-sponsors. And I know AAKP, and I know what you can do. I know what you can do with social media. I know what you can do with phone calls. I know how you can motivate policymakers to do the right thing. And I'm asking you on Living Donor Protection Act to work with us and to do that again. And we thank you for that. What are the keys to success? I think they're fairly simple. You collaborate with trusted and reliable allies like AAKP and my client ASTS and our friends at AST and KF and others. But you also do strategic planning and thinking and doing. You don't just plan, you actually have to act on it. You also really should understand the political atmosphere in which you're working. The millennial term this year is weird. This is the weirdest year ever for everyone. So we have to be cognizant of the political atmosphere in which we're working on a good year, and certainly in this year as well. We also have to understand the right levers to pull at the right time and how we collaborate with other groups. One group is doing one thing in this month and we're doing a different thing. How do we amplify our efforts by coordinating and collaborating on who's pulling the levers when? And most important for me has always been, and for AAKP leadership I know as well, is know who you're working to help. What's the goal here? The goal here is to help kidney patients, for me, kidney patients and their families to find better ways for the government to help them get better, not face burdens in trying to get their care. Thank you for listening to me today. Once again, I would love to see your shining faces at some point, hopefully in the near future. Thanks all.
Peggy, I want to thank you for that very informative presentation. I do question the 30 years of experience. You must have started when you were about 12. But I thank you for that very insightful presentation. And now we're going to hear from Mr. Rob Blaser. Rob?
Hi, I'm Rob Blaser, Director of Public Policy for the Renal Physicians Association. I tremendously appreciate the opportunity to present at the AAKP's 2020 Policy Summit. I'm going to be talking about immunosuppressive drug coverage legislation, living organ donor legislation, and Medicare Advantage and ESRD. First, I'm going to talk about immunosuppressive drug coverage legislation. The bills were introduced fairly recently, the House bill right before Christmas last year, and the Senate bill in late February, right before we went into quarantine. And the goal of these bills is lifetime coverage for immunosuppressive drugs. And really, we have an unprecedented opportunity right now to do this. And the reason is that this administration is all in for these bills. The Department of Health and Human Services Assistant Secretary for Planning and Evaluation and the Office of the Actuary have each issued reports indicating that the bill would be a big saver. And for the Office of the Actuary, that would be $300 million over 10 years. So of course, that's great news. The bills have 67 co-sponsors in the House and 16 in the Senate. And a number of those have happened since the AAKP RPA Hill Day in late June. So credit to us for getting more co-sponsors on those bills. The objective for now is to push hard for this to be addressed in the next COVID relief bill. We had heard rumblings that that might happen, or in the post-election lame duck session. They normally do what they call an omnibus lame duck bill after the election happens, and the hope is that that'll happen then. And the tide is high, not to be quoting Blondie or Deborah Harry, but the tide is high for this right now. We really have a great opportunity to make this happen, so that's what we're going to try to do. So next I'm going to talk about living organ donation. And the bill's called the Living Donor Protection Act, Senate Bill 511, House Bill 1224, and this was introduced in February of 2019, so almost 18 months ago at this point. And this addresses barriers to organ donation by prohibiting the denial of coverage or an increase in insurance premiums for living organ donors, designating organ donation surgery as a serious health condition for the purposes of the Family Medical Leave Act, and requiring HHS to update educational materials on living organ donation to reflect these changes. And before I move on, I want to talk about the fact that the Department of Labor actually issued what they call an opinion letter last year, or maybe it was even in 2018, saying they were considering the bill to be a serious health condition for the purposes of the FMLA. So on some level, this has already been taken care of, but what we really want to do is get this bill into law. So that's why we're still pursuing the living organ donation bill. It has 80 co-sponsors in the House and 19 in the Senate. And there's hope that the living organ donation bill will be included in the year-end package that will happen after the elections. Now I'm going to talk about Medicare Advantage and ESRD. And the background for this is that Medicare Advantage is a Medicare insurance product that's provided by private insurers. And this was created in 2003. It's had other names like Medicare Choice and Medicare Part C. Now it's known as Medicare Advantage. And historically, incident ESRD patients were intentionally excluded to avoid the application of HMO-like cost containment strategies. If you had ESRD when you got a Medicare Advantage plan, you could keep it, but if you were a new ESRD patient, you couldn't move into Medicare Advantage. And the idea, again, was to hopefully save ESRD patients from cost containment strategies that wouldn't work very well. As of 2021, though, all ESRD patients will be eligible for Medicare Advantage plans. And there are pros and cons to this. The pros are that it provides patient freedom of choice, plus the Medicare Advantage plans may cover products and services like medications, transportation, additional care management services not covered in Medicare fee-for-service. That's what FFS stands for. Now, the cons are that Medicare Advantage plans often use narrow provider networks, sometimes limit covered services, and tend to avoid cost-intensive patients like those with ESRD. The big update on this recently is that a final rule was issued this spring, and what it does is it eliminates time and distance standards typically used in Medicare Advantage plans, such as how many providers and physicians are in a state or a coverage area and how far away are they. And this was just for ESRD. It still exists for a lot of other disease states, but not for ESRD. Now, this decision was considered to be quite favorable for home dialysis, which of course is a good thing. We should be doing everything we can to promote home dialysis, but there is concern about patients who are not good candidates for home dialysis or prefer in-center care. Also, there's been a narrowing of nephrologist networks that has already begun. In one state, we know of 25 of 32 nephrologists in the Medicare Advantage plan have been told that their contracts will be terminated for 2021. And this is obviously a problem. All the patients who see those nephrologists, if they want to keep their Medicare Advantage plans, are probably going to have to change nephrologists or change their insurance and go back to fee-for-service. So it does provide a bit of a conundrum. So the implementation of Medicare Advantage, while it's something that a lot of people in the community advocated for over the years, it does present challenges along with the positives. I want to thank AAKP for the opportunity to present today. And if you have any questions about anything that I've said, you can see my contact information there. Feel free to send me an email and I'll be happy to respond. Again, thanks so much, AAKP. Appreciate the time.
Rob, once again, I appreciate you joining us and thank you for that very, very insightful presentation. Particularly enjoyed the information about Medicare Advantage. And Rob, you bring your usual energy, which we all appreciate. Certainly, many of the patients are familiar with how you present, and we certainly appreciate your insights that you provided us. Now, we're going to hear from Crystal, Dr. Gadegbeku. Take it away. We're looking forward to hearing your insights.
Thank you, AAKP, for having me today. It's wonderful to be here. I'm Crystal Gadegbeku, a professor of medicine at Lewis Katz School of Medicine at Temple University. I've also been a previous American Society of Nephrology Chair of Policy and Advocacy, and am currently on American Society of Nephrology Council. Today, I'm going to talk to you about AAKH executive order in the time of COVID-19. Much has happened since the executive order was talked about. As you all know, it's not something that we just mention in the kidney community. It is reached a widespread audience and has been on mainstream TV as well as in the papers. Okay, today there'll be 4 themes or takeaways based on what's been happening today. Number 1, the executive order and COVID-19 have made very, very clear that the status quo is just unacceptable. Implementation of the executive order policies are seen as urgent more than ever now that we are in the midst of this pandemic. Also, this pandemic has highlighted health disparities for our patients and for all patients. And with the excess of the executive order, this would be the best response to COVID-19 and benefit all patients. So let's start with talking about telehealth and home dialysis. One thing has been clear, that expanding telehealth is a definite positive thing for our country. Telehealth is a benefit for not only our rural areas, but like I've seen in the city of Philadelphia, it has been great to be able to have greater access to our patients, even within the city. And now, since the beginning of August here, there have been expanded telehealth in rural areas. And as I will mention later on, this is a big plus because of the lack of physicians and access to care in those areas. Now, with telehealth, we have greater flexibility on how we and patients interact. There's the ability to have both telehealth and in-person visits, and all of this leading to better outcomes and better care. And regarding the way I feel, telehealth is here to stay. It is an approach that will have its place in healthcare for the future. However, given this pandemic, there has been an expansion of the use of telehealth to make sure we take adequate care of patients who cannot really be in front of us due to the risks. And enabling home dialysis. Well, it's great to see that telehealth is really something that is helpful for home dialysis care. First of all, the end-stage renal disease treatment choice model, that is the mandatory model proposed by CMS and as certainly part of the executive order, has a heavy emphasis on home dialysis and kidney transplantation, which is something that we have definitely applauded. Telehealth will make this provision much more easily obtained, and the payment now is matched with in-center payment. Now, next steps that ASN sees is that the home dialysis needs to have further support with home assistance for patients to allow them to reach their best outcomes. Okay, moving on to transplant. So one of the major goals of the executive order is to increase transplantation. The reforms that are proposed by the OPO will significantly help in this regard. We want to increase the number of organs available because we know that ultimately will save lives. We are pushing now for HHS to finalize these reforms as they're so important to the mission. And as the ETC model, that is the mandatory model that is being put forward, kidney transplantation is obviously emphasized. And we need this model to be finalized with regard to transplantation so we can have the greatest success. In addition to the mandatory models, there are the voluntary models, and they are also incentivizing home dialysis as well as transplantation. These models are soon underway. ASN has taken responsibility for providing educations to physicians so that we can make the most of these new models as they're being implemented. Now I want to discuss kidney research with you. Much has been happening in the kidney research space. First of all, COVID-19 underscores the need for investment in kidney research. Kidney patients, as you probably all know, have a greater mortality from COVID-19 infection, 2 to 3-fold that of the general population. And we also well know that COVID-19 infection causes acute kidney injury. Unfortunately, National Institute of Diabetes, Digestive and Kidney Diseases, the NIDDK, the home for national research, did not receive COVID-19 emergency supplemental funding, but hope is on the horizon. There are two provisions now that will hopefully increase NIDDK's research funding specifically focused on COVID-19. First, in the Senate, $200 million bill has just been released for funding the NIDDK. And in the House, there's a proposal for similar funds, $154 million in the emergency supplemental package. We need to voice our opinion on these to push this investment forward. So regarding catalyzing kidney innovation, Kidney X, which was mandated in the executive order to accelerate innovations in the kidney space, is a public and private partnership between American Society of Nephrology and HHS. Kidney X is doing wonderful things towards its mission. Most recently, 6 $500,000 prizes were awarded to redesign dialysis 2 for the technologies to replicate normal kidney function and improve dialysis access. In addition to those 6 prizes, 25 prizes for the Patient Innovator Challenge was awarded, and these are for patient and caregiver ideas and solutions to improve therapeutic options. I love the fact that these prizes are in place because we have both great minds in technology as well as equal prizes for patients and caregivers who are really at the ready and at the patient level providing care. There's a full list of Kidney X prize winners that you can research in your own time. So as I previously mentioned, Kidney X was mandated by the executive order to catalyze innovative therapies in the kidney space, and that includes a wearable or implantable artificial kidney. The COVID-19 crisis that we are in now creates additional sense of urgency for artificial kidneys. First of all, patients who are in in-center dialysis cannot really comply with the social distancing as they have to transport themselves and be in dialysis. And so having home dialysis therapies or kidney transplantation become even more important for their safety. In addition, we know that COVID-19 causes kidney injury that could lead to later kidney disease and end-stage renal disease. And therefore, it is important that these benefits here and wearable implantable kidney would be great in order to support these patients in the future. Now, I believe, and Kidney X believes, that these multiple prototypes are going to be available soon and start clinical trials, likely in 2024. Much like vaccinations for COVID-19 infection, having funding really accelerates these things to be in fruition and actually be utilized. Therefore, ASN is asking Congress for funds for this artificial kidney prize to really fully and completely fulfill the goals of the executive order. Now, it's important to mention the healthcare workforce. Maintaining the healthcare workforce is and will be very important. International medical graduates make up a significant portion of our health healthcare workforce, particularly in nephrology. They comprise almost 50% of our nation's nephrologists and a third of our overall physicians. That is not enough. It is surprising and woeful to admit that 135 U.S. counties lack one single physician. And I'm not talking about a nephrologist. I'm just talking about a primary care physician or any physician. And we see, or there's projections by the AAMC, that by 2023, which is really just around the corner, there'll be a shortage of 122,000 physicians in this country. We have ways to immediately address this situation. First, passage of the Healthcare Workforce Resilience Act could really have a great impact. This would recapture immigrant visas for nurses and physicians to the tune of 25,000 nurses and 15,000 physicians who are ready and willing to work in our country, but cannot under the current restrictions. Further, enhancing the Conrad 30 program, that is a program that is focused on foreign-born doctors, but who have completed medical residency here in this country and are willing to work. Expanding this will allow us to replenish our workforce, which is so keenly needed. So we have X-ray vision and we have tunnel vision. The roadmap has been set for us, and we know what we need to accomplish. The X-ray vision is that advancing the American Kidney Health Initiative has established a roadmap to address many of the kidney issues we see today and is already working towards this. In addition, COVID-19 has exposed numerous issues within our healthcare, and especially within kidney care, and in some sense has accelerated the priorities. And so these things, AAKH and COVID-19, have cumulatively brought forth the issues of today that need to be fixed. And the urgency is clearly there. We need more urgently. We need to have this kidney prize so that we can have an artificial kidney. We need to have new care models so that we can better take care of patients. And furthermore, we need to propose and develop interventions that will deal with the health disparities that we clearly see in kidney disease. We are here to build the future that we want. Thank you so much for allowing me to be here. I'm grateful to the AAKP as well as American Society of Nephrology community and the kidney community, as well as the staff for being along with me on this journey. And I hope that we will continue to make great progress for patients with kidney disease. Thank you.
Wow, Crystal, that was exciting. I want to thank you for that presentation. And now we're going to go right to questions. Ms. T, AAKP believes Congress and the federal government can indeed impact kidney policy, but the onus for long-term change and progress rests with the kidney community. How can kidney patients, consumers, and organizations like AAKP, how can we help keep up the momentum for better policies?
I know you're being active, you're doing some amazing things. I think the drumbeat, keeping it up, keeping it interesting, catching attention on social media. Your leaders are particularly clever in coming up with ways to capture attention. It's not just a usual message. It's clever, it's interesting, it's timely, it's a throwback to the 70s, for example. So do more of that, keep doing that, keep collaborating with us, and really don't let your members of Congress off easy. A lot of staffers will say to you, thank you for taking the time. But you need to ask the hard question. Do you think your boss, if you're talking to the staffer, do you think your boss will co-sponsor this bill? Question one. Question two, do you think your boss will try to advance this bill through the committees of jurisdiction and to the House or the Senate floor? It is not rude. I used to be a nice girl from Ohio. I think I still am. It is not rude to ask those hard questions. That's why you're making those phone calls. That's why you're writing those emails. ask the hard questions, and you'll find that you can deliver better when you ask the hard questions.
Rob, we have a couple of questions for you as well. As a policy professional, do you recall a time when national kidney policy initiatives like the executive order has put the patient consumer fully at the center of the care discussion?
You know, I really can't think of any precedent for the current situation with what this administration did with the executive order. It's really amazing how at the center patients are and what they did. Their emphasis on home dialysis, their emphasis on promoting transplantation. It's really, I mean, the executive order by itself was a really historic thing, but to the extent to which the administration put patients at the center is another really unique aspect. And to answer the question, I really can't think of any precedent or any other time where that happened to the extent that it happened in this case. And a lot of the credit for that does go to AAKP policy people and policy professionals, because I'm sure they had a big hand in it.
Rob, we have another question for you. AAKP and the Renal Physicians Association share a long and very close history. Can you tell us the impact that patients have on Capitol Hill and within the executive branch? And does the patient voice, does it really make a difference in advancing innovation for the larger kidney community?
It's funny to be asked this question because we've been saying for years that there's nothing like the patient-physician combination to go into Hill offices to tell the story, because that's really what all this is about, is telling the story. And physicians have their story to tell, of course, but there's nothing like having the patients alongside to be able to put a face on the folks who are experiencing this firsthand. A story I always tell is that back in the days when physician payment was an issue and the sustainable growth rate was a way that docs got paid by Medicare, one of our physicians from Philadelphia was going, and we figured out that one of his patients was going to be the patient that would be going with him. And he told us that in every office they went into, the patient wagged his finger at the Hill staff, saying, "You got to make sure my doctor gets paid what he deserves because he gives me great care." And our doc came back and said, "I didn't have to say a word. He said everything for me." So really, the combination is just outstanding, and it applies on the executive, on the executive branch as well. Nothing like having the patient perspective on these issues be presented, and it couldn't be more effective than it is. And we treasure the relationship that we have with AAKP.
Okay, Crystal, I've got a couple of questions for you as well. As you know, AAKP and ASN have been strategic allies for a long period of time. We've been on Capitol Hill with you together many times to discuss policy related to innovation and patient access. Can you tell us your observations as a nephrologist and the policy influence and impact patients have in meeting with elected officials and their staff?
That's a very good question. As a member of the American Society of Nephrology Policy Committee, and actually chairing that committee, I've had the wonderful experience of being on Capitol Hill over several years. And I've seen over that time period our visibility grow and increase, and our relationship with officials and continue to improve. Of all the experiences I've had on Capitol Hill, I have to say my experiences with members of AAKP and patients have been the most impactful. Why? It's that when you bring your personal story into the room, it elevates the conversation. I can talk to my blue in the face about kidney disease and about my experiences. It will never have the impact of the personal experience and the human message that's there. And I become window dressing, only supporting the central message, which it comes from you. You are a constituent. They work for you. So having you there to state the issues you see and the problems is so very important, and very important to the I think, the successes that we've achieved so far. And I think it's extremely important to the successes we will achieve in the future and the goals we have for ourselves in the future.
Crystal, I've got another question that really relates to many of the points that I discussed during our introduction earlier today. As we both know, kidney disease disproportionately impacts communities of color, including the highest mortality rates. To the patients listening to you today, why do you think it is important for them to become involved as patient advocates? And can they really help AAKP and ASN advance the inclusion of more diverse patients in the policy decisions and clinical trials that support innovation?
Another great question. Look, we have a wonderful opportunity. The stars are aligning for us in the kidney space, and health disparities is a key issue. So in order to be heard, we need to be visible. We need to be out there. We need to be telling the problem, stating the problem. Because if our officials and our legislators are not aware, they can't help us. So it is extremely important to gather people to the Hill as much as we can to remind them of the struggles of kidney disease in people of color and of the health disparities related to kidney disease. Again, if we're not there, we cannot make the change happen.
I want to thank everybody. Crystal, Rob, Peggy, I really want to thank you for your presentations and, more importantly, your answers to the specific questions that you were asked. I want everybody out there to know that you three represent some of my go-to people when I need to get insights and information. We really appreciate your participating in the program today. You've added great value, and to all who are attending, we appreciate your insights that you provided to us, and we look forward to the next time.